Hello everyone, I'm Charlotte Girard. I am a rheumatologist in the Geneva University Hospital in Switzerland, and I will talk to you today about non-pharmacological treatment of systemic lupus erythematosus, I would say SLE. Why am I interested in telling you more about this is because I was involved in the elaboration of FAI²R recommendation for the non-pharmacological treatment of systemic lupus erythematosus and systemic sclerosis within a FAI²R task force project that was published last year. And I will start with reminding you about some lupus features. I won't give a complete course about lupus today, but I thought it would be interesting to remind you that lupus is one of the most systemic diseases ever, with the many organ manifestations, and is associated with a high morbid mortality burden because of organ damages, but also cardiovascular burden and complication of immunosuppressants, including infections. And lupus is related with a poor health-related quality of life, despite recent advances in medical treatment. And I wanted to insist on one of the most important and treatment refractory symptom, which is fatigue, which, as I just said, remained a concern for many patients and physicians that treat lupus patients. Before going further in my conference, I will remind you about the definition of non-pharmacological treatment, starting with the definition of what is a pharmacological treatment. And to do so, we used the European Directive of 201 that are still actual and say that a pharmacological treatment or medicinal product is any substance or combination of substances which may be used in or administered to human beings, either with a view of restoring, correcting, or modifying physiological functions by exerting a pharmacological, immunological, or metabolic action, or to making a medical diagnosis. So, saying that, I think that you can imagine various non-pharmacological treatment that you probably already used in your everyday practice, like, for example, diet, physical activity, psychological support, smoking cessation, weight loss, etc., etc. So this is basically how we conducted our project to publish this recommendation about non-pharmacological treatment of lupus and systemic sclerosis, but I won't mention here the non-pharmacological treatment of systemic sclerosis, which is another subject. We thought that non-pharmacological treatment could be useful, but were insufficiently standardized and used in systemic lupus erythematosus. So we performed a systematic literature review in order to answer to some predefined questions regarding the kind of non-pharmacological treatment that had been studied in lupus, the effects of the studied treatment, and the outcomes that have been measured. And thanks to the data from this SLR and to the results of several discussions that we had between all the members of the task force, comprising rheumatologists, healthcare providers, so nurses, psychologists, physiotherapists, occupational therapists, and patient research partner. We were able to formulate overarching principles and recommendations for the non-pharmacological treatment of SLE. These are our overarching principles. So we first agreed that non-pharmacological treatment of lupus should be tailored to patients' needs, expectations, and preferences, and be based on a shared decision-making. Then we thought that it should include one or more interventions, that it should be used as an adjunct to pharmaceutical treatment, but could also be used alone, for example, in a patient where there would be no indication to start a medical treatment. But we all agreed that non-pharmacological treatment should not substitute for pharmaceutical treatment when the latter was required. These are our 9 recommendations regarding non-pharmacological management in lupus. And the first one was that given what we found in literature, the non-pharmacological treatment should be directed toward improving health-related quality of life, because we have no sufficient data to date to think that non-pharmacological treatment could be useful to improve, for example, to lower disease activity or something like that. But what is proved is that it can improve health-related quality of life. Then we agreed that patients with SLE should be offered patient education and self-management support, that smoking habits should be assessed and cessation strategies implemented when necessary, even if the evidence in literature was low regarding smoking habits. It was for avoidance of cold exposure, but since some lupus patients also have Raynaud phenomenon, we thought it would be important to avoid cold exposure in order to decrease manifestation related to Raynaud phenomenon in these patients. Physical exercise is the intervention that was the most studied, and from what we could get the more information in our systematic literature review, and we agreed that it should be considered for patients with lupus. Photoprotection, of course, everyone knows that patients with lupus should avoid sun exposure because of radiation, UV radiation that can trigger flares of the disease. But this is, as you can see, from a very low level of evidence, because no studies prove that photoprotection is efficient in lupus. Psychosocial intervention are also shown as interesting in improving health-related quality of life, in diminishing anxiety and depressive symptoms, and is then recommended in the management of lupus. And as I said, aerobic exercise and physical exercise is highly recommended, but must be tailored to patients and must respect some contraindications like cardiovascular disease or severe articular disease, for example. We finished our recommendation by establishing a research agenda that points out the important and unmet needs so far. First, as you could see, our recommendations are based on quite a very low level of evidence studies, and randomized controlled trials with lining strategies should be conducted in order to assess more robustly non-pharmacological treatment in lupus. The identification of patients' needs for non-pharmacological treatment is essential, and strategies for identifying such needs should be implemented. As you could also notice, dietary programs were not that studied so far, so this is also an important field of research, and we encourage studies on diets in lupus, especially since many patients are very, very interested in that. So to conclude, I would say that we have a lack of high levels of evidence studies to assess the efficacy of non-pharmacological treatment in lupus. This treatment can be adjuncted to pharmaceutical treatment and must be tailored to patients' needs. We agreed in the task force that physical activity and exercise were beneficial for patients, as well as patient education, self-management, and psychological interventions. Photoprotection, cold avoidance, and smoking cessations are also recommended, even if not really robustly assessed in the literature, but everyone agreed in the task force to recognize that. And a question mark is here regarding dietary programs, since we don't have any studies exploring the potential effects of diet in lupus patients. The management of lupus must be holistic and patient-centered. And I will also point out the importance of educating not only patients but also healthcare professionals on the potentiality of different non-pharmacological strategies. And in this idea, I would invite you to answer to this quick online survey that we performed with the people of the FAI²R group of non-pharmacological treatment of autoimmune connectivitis, and which is dedicated to assess the clinical practice regarding non-pharmacological treatment in lupus and scleroderma. So if you want to answer this survey, you are very welcome, and you have the link here, and we'll also find the link via LinkedIn. I thank you for your attention and wish you a pleasant day.